India sees over lakhs people lose an arm or legs. Does that number scares you?
India is a diabetes capital. 1 in every 10 patients suffer from diabetes. Once that gangrene sets up, you have to amputate the limbs.
We have seen Hardik Pandya struggle with recurring injuries and a lot of surgeries. So what actually cause athletes to break down like this? So like what are the most common sports injury you see like maybe in football or cricket? Nowadays everyone is doing marathons, running, gymming. What injuries are you seeing the most like in that particular stuff? What is the one mistake that cause most of them? Many people have flat feet. Should they worry about?
30% of people in the world have flat feet.
So why do women get heel pain?
Children are not going out that much. It might cause a problem.
Do shoes like heels or bad footwear actually damage our feet?
I was helpless. I didn't know anyone who was qualified enough in India to treat such a problem that we had. And unfortunately, females do get a lot of deformities more than men.
When does it become a real problem? What is diabetic foot?
The blood flow decreases to the parts of the body. We can actually help people to prevent the amputation.
How does diabetes destroy a foot?
So instead of scaring me, it actually motivates me.
Today, our guest is someone who chose a path that almost nobody in India has taken. There are barely few foot and ankle super specialists in the entire country, and he is one of them. He doesn't just treat feet; he treats the foundation of entire body. Please welcome Dr. Parth Parekh. Welcome to the show, Dr. Parth.
Thank you.
Let's start with India first. Like India sees over lakhs people lose an arm or legs every year, most because of diabetes. And you are one of only few specialists dealing with this. Does that number scares you?
Yeah, so you are right, Parth, that India is a diabetes capital and of the world, and around say 1 in every 10 patients suffer from diabetes. And because of that, what happens basically in diabetes is that the blood flow decreases to the parts of the body, and due to that, gangrene happens. And once that gangrene sets up, you have to amputate the limbs. That can be a hand or a foot. So instead of scaring me, it actually motivates me because we are the people, because of this technical know-how and the foot and ankle specialty that we have done, we can actually help people to prevent the amputation. So we have so many patients where they come from different parts of India and say that, we have been told that advice that amputation is needed, and somehow with our knowledge and expertise, we are trying, able to save that limb. So
Right.
it is actually a motivation for me that wherever they come from and they are said that there is no other option but to amputate, and we kind of save that limb. So it is
Right.
actually a motivation for us rather than being scared about it.
Yeah, exactly. So, what made you become a orthopedic doctor, and especially in foot and ankle? Like, where did all started? Like, you can tell more about your journey.
Okay. So basically, my dad is an orthopedic surgeon also, and he was one of the few knee replacement surgeons, the first few knee replacement surgeons of Gujarat. So he always had a knack of doing something unique, something new. And since I was a child, I have been, traveling with him to the hospitals and everywhere, taking rounds with him in the evenings. So I was always motivated to become a doctor.
Yeah.
And then so much of orthopedic surgeries that you've been around, you naturally have that tendency to get attracted to that field.
Right.
Once I was an orthopedic surgeon, there's an interesting story. One of my friends who was a national football player, and he suffered a very bad injury, and his ligaments were broken. And I was helpless because I was an orthopedic surgeon, his good friend, but I didn't know anyone who was qualified enough in India to treat such the problem that he had.
Right.
And unfortunately, he had to go to Spain and get treated and come back, and he got rehabilitation, and then he played for the country also. But the thing was that at that time I saw that there are not many qualified foot and ankle specialists in India, and that made me realize that that is something unique, something new that I should be doing. And that's why I then went to the United States and got my fellowship done for a year. learned about the different modalities, the different specialities, came back and started my practice. So
Right.
that is that incident of my friend actually made me motivated me to pursue
Right.
this.
So ideally, that was the spark.
Yes,
Yes.
yes.
Right. So what kind of patients do you see the most, and which cases excites you the most as a surgeon?
So patients, we see a range of patients from heel pain, basic heel pain in the morning, to patients who have sports injuries, who have had some kind of a injury while playing sports, to people who have had, like we discussed, diabetes and problems due to that, non-healing ulcers. We see a lot of flat feet patients also. The cases that excite me more is one of the patient, all the patients when I see them coming back to walking and going for runs and everything, especially sports people. So whenever athletes come to us, be it a kabaddi player, a badminton player, or a basketball player, and we operate them, or we have some kind of a conservative treatment for them, and they get back to the sports and start playing again.
Right.
That is what excites me, and that is seeing them playing. Is they send me videos. Doctor साहब ये हम खेलने लग गए वापस. So that is what is exciting part of the whole
Nice,
journey for
nice.
me.
So, like, what are the most common sports injury you see, like maybe in football or cricket? As you just said, right? A lot of athletes coming to you. So, what kind of injuries generally happening?
Yeah. So basically, previously, all the contact sports had sports injuries like football, like cricket. But now we are seeing even non-contact sports like tennis. They also, people suffer sports injury. Sports injury basically means any type of ligament damage in the ankle or around the ankle, if we are
Right.
talking about foot and ankle only. Stress fractures when you are overdoing, exercises or practices or matches. You do go through stress injuries, stress fractures.
Right.
Tendo Achilles is one of those injuries which it snaps while jumping. So if you are playing volleyball or basketball, tendo Achilles tears are very common. So these are the injuries generally that we deal with during sports like tennis or cricket or something like that.
Okay. Yeah. So, like nowadays, everyone is doing marathons, running, gymming, right? So, what injuries are you seeing the most, like in that particular stuff? And what is the one mistake that cause most of them?
So it is actually good. Even in Ahmedabad, if you see cycling, marathon, everything has taken a very huge leap towards people
Right.
getting engaged, getting aware, and people coming and getting involved. But the problem, the first problem I see is for them just to start it in a way that they want to go all out in the first session. So I have seen many people who even if they are playing pickleball, they want to play 5 games at a trot the first time they're playing.
Right.
Or someone who started running and wants to do a marathon in a week or a 10 days or 20 days. Cycling similar, they start cycling for 1-2 kilometers and they suddenly think that they can cycle for like 50 kilometers or 100 kilometers. So the main thing is they are not prepared. They don't go gradually to that level. No warm-ups. So these are the problems that we see. So the first mistake that they make is thinking that they can do everything without any kind of precautions.
Right. It's like overplay, right?
Yes, yes, overplay and just
Yes.
going for it.
Okay. And what precautions should people take to avoid, workout or sports injuries?
Yeah, it's an excellent question. So generally, what we even the athletes that we advise or train, we tell them that 2 or 3 things you need to be very careful about. One is trying to warm up before doing anything, or the warm up exercises like stretching. All those things have to be done. They are very important. They are as equal to what you're going to play or practice. Second is the shoes. They should be comfortable. They should be proper.
Right.
Nutrition, sleep. These are all the things that you need to take care of and gradually building up to that level. So like we discussed that you have to gradually build up to a level. You can't go to a gym the first day and have a 40 kg dumbbell
Right.
and start doing it. So gradually increasing the level and basically warm-ups are the basic advice I would give to any sports person.
So we have seen Hardik Pandya, right, a famous cricketer. So struggle with recurring injuries. Like he had a lot of injuries and a lot of surgeries, and he has done, right. So what actually caused athletes to break down like this?
So any player who is an international player in any sport, and like Hardik Pandya, they are elite players. So
Yeah.
they like overuse their body a lot. The things that they require from their body to do to just to keep them into that level of international exposure is the body goes through a lot. So sometimes what happens is because of this overloading, some injuries happen. When you are injured, the rehabilitation process which is there, which is advised or which is made for a player particularly, sometimes they want to rush through it, so that rehabilitation is incomplete.
Yes.
And sometimes it's just that they want to start again without basically going through those stages of rehabilitation.
Right.
So incomplete rehabilitation, coming back earlier than expected, and overusing those things, I think those are the things that would be a major thing for a recurrence of an injury, like a player like Hardik
Yes,
Pandya.
yes. And like similar to the like a player, a very good player of football, Cristiano Ronaldo, right? He is playing from so long, right? And he is injury free from last many years, right? So what are the doing, like what he is doing differently from the other players?
So all those players who believe in real science of knowledge, science of the body, they have nutritionist. Their personal nutritionist. They're a person who takes care of their whole. What are the body having in terms of water, in terms of nutrition, exactly what the intake is, how is the outflow, what time they are eating. That is one thing. Second thing, sleep is as equal and important in your life. So
Right.
the proper sleep cycle, proper nutrition cycle, exercises, how they are doing it specifically for his body, for his age. There are certain exercises that they will be doing. They would be warming up properly, stretches and everything would be done, and then they would be gradually getting into the training. Even the training hours are fixed, how many times a day they would train, what hours they would train. So basically taking care of yourself in each and every aspect of the whole day
Right.
is what makes these certain individuals completely different, and they're almost like machines. Their bodies are like a machine. From what I remember, Ronaldo is 40 and his biological age is 40 and his age is 32 or something in terms
I
of his
also heard that.
parameters.
Yes, yes.
So that's amazing. How do they take care of
That's how
themselves?
he has trained his body.
Yes, exactly.
Yes, yes. And many people have flat feet, right? So should they worry about or they can ignore it?
So Parth, again, 30% of people in the world have flat feet. It is not really an anomaly. But when these flat feet become symptomatic, that means you have pain in the feet, you cannot run faster, you cannot stand for a long period of time, or when you are going up and down the stairs, it's painful. That is when these flat feet have a problem, and that is where you should take care of them. And that is where a foot and ankle surgeon's advice is best to be taken.
Okay, so what is the basic remedies or treatment you recommend?
So, flat feet, like you said, feet are the foundation of the body. When your feet are flat, that means the arches go down.
Right.
So your knees, your hips, and your spine, everything is connected to that. So
Yeah.
the biomechanical axis changes, and that can give rise to knee pain, hip pain, or spine or back pain in the long run. So that is why it is important for them to be completely straight.
Right.
Now they are asymptomatic. That means the parents have seen that, okay, children have flat feet, because again, it is a hereditary condition.
Right.
So if parents have it, the children are bound to have it. So if you have flat feet, there is nothing to worry. If there are no symptoms of pain or any deformity, you can just have physiotherapy in terms of exercises at home or with a physiotherapist, or you can just have a customized insoles given in the shoes, or something like orthotics that can take care of the biomechanical axis of the flat foot, and that way the knees, hips, and spine is also taken care
Right.
of.
Right.
The problem comes when it is a symptomatic flat feet. Symptoms, when there are symptoms, that means that some part of the body, which is one of the tendons, which is known as the posterior tibial tendon, is having an effect on the body, and the flat feet is causing that. And that is when an intervention by a foot and ankle surgeon is required. And that is when we tell the patients that this is the time that we should do something which is active.
Right. Right. Exactly. And why is the flat foot especially common in the children? And are parents right to worry, or is it mostly fine?
So parents now should be worried. Now I'll tell you a very interesting fact. My father has flat feet.
Right.
Plenty of people of that generation, say 70, 75, have flat feet, but they've never had pain.
Right.
So even people who are listening to this podcast, their fathers, or if they are 70, they would be having flat feet, but they would have no problems with any pain or anything like that. And why is that? Because at that point of time, people used to walk a lot, they used to run, they used to play, they used to get vegetables, everything like that. Again, the generation after that, I'm talking about, say, from age 35 to 55 right now, they don't have that much pain. And that is, again, because we used to go to school in, say, cycles, walking, used to play in the evenings, we used to play so many for so many time. So all these things always compensated for your flat feet. The other muscles and the tendons used to compensate for your biomechanical problem. But now what is happening is the children are not going out that much. They are in their iPads, iPods, phones and everything. They are more sedentary. They would prefer to stay at home, and that is why those compensations are not happening.
Right.
Not many people are serious about any sport or something like that. They are not playing in the evenings. No cycling. They are going to school with drivers and everything. So these are all the things where compensations don't happen, and the flat feet then is painful. So that is why in our practice now we are seeing more of the children from age 8 to 16 that we need to actively get involved, that is do a surgery in them, because the pain have started in such a way that if we don't do a surgery, a preventive surgery, it might cause a problem.
And you were the first in the Gujarat to perform minimally invasive flat foot reconstruction, right? So what exactly it is?
So this is a very beautiful procedure that we do in people who have symptoms. Like I said, that if the children from, so it is done from 9 years to 39 years. Whenever you have symptoms which are not going even after insoles or exercises, this is where we do that procedure. And basically what we do is we put a titanium stent into a place and it acts as a stopper. And what it does is that it completely removes the flat foot. You get those arches back. The biomechanical axis which is not aligned becomes aligned. So knee, hip, and spine become proper. And because the flat foot gets corrected,
Right.
All those problems centered around it also completely go away. So that is why we do it. And the second best thing about it is that it is just a 1-inch incision. You can start walking from the very next day.
Okay.
So it doesn't require any bed rest or something like that. It is not a procedure where we are cutting the bones or anything like that. So it is a preventive surgery for more problems don't happen in a flat foot children. But again, it is just for flat feet with symptoms and not asymptomatic ones. Asymptomatic ones we treat by insoles or physiotherapy or something like that.
Right. So do shoes like heels or bed footwear, right, actually damage our feet?
Yes, definitely. Flats, bellies, heels, shoes with pointed toes, they all damage, they have a damaging effect on our feet. And because of that, we always kind of advise people to wear wear shoes we are comfortable, which have cushions, which have broad toe boxes, which are more comfortable rather than just going for the brands.
Right. So why do women get heel pain, like deformatives, like hammer toes, like claw toes, high arch, and far more than men?
Yeah.
Is it footwear, the lifestyle, or something biological?
So it is a combination of all of them. Footwear, because many a times we see Indian females not wearing proper footwear in the house, even outside. We see so the age from 35 to 55, there are lots of hormonal issues also going on. Laxity also happens. So these are also these things. Third, they don't take care of their feet because they're always busy taking care of the family, the husbands, the children, the fathers, and everyone. So all the combinations of all this makes them have a thing which is known as a plantar fasciitis, which is the heel pain in the morning. Whenever they get up, they have that heel pain, sharp shooting pain, and which gradually becomes a little lesser during the day. So that is one of the reasons why females have that. Secondly, the toe deformities are very interesting because when the toes, get angulated and come over each other, that is these all deformities need to be corrected. If they are not corrected, they may, in the long run, create problems with the skin as well as the bones.
Right.
So females do get a lot of deformities and more than men, and these are the reasons why they would get that.
Okay. So this kind of small stuff can lead to the surgeries as well?
Yes, definitely. So once the angles of the toes are so angulated that they go over each other, we have to align them properly.
Right.
And for that, because if they are not aligned, they will lead to a kind of a situation where you are not walking properly, or when you may be falling off, or maybe causing ulcers which are non-healing because of the constant rub of the skin.
Right. Okay. So bunions, the bump on the side of the foot, right? So hammer toes, like bent toes. What causes it, and when does it become a real problem?
So bunions as well. Bunions are basically also caused by hereditary symptoms. So if your parents have it, you would naturally have them in the long run. But also occupational hazards like pointing shoes and heels would cause wherever there is a constriction of the toes, it would cause a bunion. And bunion is basically your great toe coming over to the second and third toe. And if you're not careful about it, again, it may lead to instability. You may fall. There would be ulcers over there. There would be fractures over there. And so once the angulation is that much that it cannot be corrected just by splints or spacers or something like that, we do recommend and advise a surgery for that.
Okay.
And now, because we are at par with the international standards, we have been doing surgeries which are known as the minimal invasive surgeries. So say for example, bunion surgeries, before we were doing, say before 2 years I was doing it, required a cutting of the bones in such a manner that 6 weeks bed rest was needed.
Oh.
And now we are doing it, and the next day you can start walking.
Oh.
And it is almost the same surgery, but only 1 or 2 incisions of 1 inch, and second day you can start walking.
That's impressive.
That is amazing, the way world is going out.
Nice. Okay. And ankle sprain, everybody had once in a while, right? So most people just ice it and walk it off, right? So when it is the serious mistake?
Okay, so like you said, everyone has had an ankle sprain, and once we've always had one patient at least every day coming with an ankle sprain. So what I tell them is 90% of the ankle sprains that you get, say by just going through the stairs or just falling off the hill or falling off the road, they are just a sprain. Sprain is just a stretching of the ligament, right? And it comes back to normal. So what you do is generally just take rest for 5 days, just elevate your limb on a pillow or something like that. Give compression in terms of crepe bandage, pelo gulab patto that they say.
Yes.
And ice application and some kind of a medication which the inflammation is controlled. So this is what everyone does, and by 5 to 7 days it is you are okay and you can start again. But those 10% of the people where this ligament itself is stretched, it's not stretched, but it becomes lax or it tears.
Yeah.
That is, we call it the anterior talofibular ligament, the ATFL. And in those 10% people, the ligament, once it tears, you need to do something about it. And those are the actual sports injuries that we deal with. And we need to reconstruct that whole ligament.
Right.
So in those 10%, how do you differentiate if you're not coming in that 10%? Is basic thing we say is see for 15 days. If after 15 days also you have some kind of pain in the ankle, or you are getting swelling even after walking a little bit distance, and it's more than 2 weeks, definitely you should consult a foot and ankle surgeon, because then the chances of ATFL tear increases a lot. Otherwise, if it's a normal ankle sprain, by 7 days you should be fine.
At least 2 weeks people can wait, right?
Yes.
Okay, so like diabetic foot. Many people have heard this word, but don't fully understand it, what it is. Can you explain it in very simple term? What is diabetic foot?
Okay, so diabetes, once you have diabetes, high diabetes, uncontrolled diabetes, what happens is your blood flow to the extreme parts of your body kind of becomes dried up. So the blood flow is not there that much. And that is why skin starts becoming dry, your bones start also having problems. The sensory loss is also there. So if you say that you have a small fracture or a small ulcer, you and I will not be able to step on it, and we will see that there is some problem going on. But people with high diabetes, which is known as a neuropathic joint, they will not know what is happening. So even if they have a fracture of the foot, they'll be walking normally.
Right.
So someone else has to see that there is some kind of a deformity happening. And similarly, because of the low blood flow there, chances of gangrene develop. And that is why if you are not taking care of that, it may ultimately lead to something like an amputation, which is very common.
Okay. And how does diabetes destroy a foot? And what can be done to stop it?
So diabetes has 3 effects on the foot. One, because of the less blood flow, the wound healing capabilities go away. Even a small nick can lead to big ulcers, and because you have no sensations, those ulcers keep on growing and you have no idea what is happening. And third, infection sets in because of the less blood flow, and that can lead to a very drastic problem. As well as the bones being, if you have a high uncontrolled diabetes, you can have Charcot's bones, which again is a different problem altogether. For them to become stable and for them to be in one place, again, surgeries are needed for them to be reconstructed.
Getting a specialist appointment takes months, right? But here in India, it will take within a week you can have appointment like a super specialist, right? So why does that gap exist? And is India's speed actually a good thing, or does it cuts come?
Yeah, so I actually think that we are very lucky to be in this situation in India where you can take an appointment for a super specialist, and within at least 2 to 3 days you get an appointment. Like our center gives an appointment by 48 hours or 2 days, so not much of waiting. So people are not actually realizing how lucky they are, because in countries like US and UK, like you said, appointment with a foot and ankle specialist or any super specialist by far takes about 2 to 3 months minimum for them to just meet them.
Right.
Right. And over here you can get it in 2 days. So people kind of take it for granted sometimes that even if they have to wait 5 minutes more,
Right.
if they have given a 11 o'clock appointment and 11:05 or bow hour થઈ ગઈ doctor. But people from outside definitely are so impressed when they come.
Right.
We have lots of people coming from Africa and Australia, and they are so happy that within some hours your consultation is done, MRI is done, X-ray is done, what is the problem, the advice given to them, everything is done around in 6 to 8 hours.
Right.
And which is almost impossible in US and UK. So that is a very big change and very big difference between the.
Okay. So what's the one major difference between the healthcare systems, like in the US and UK, like and the India as well? Because you have been to the England and US as well, right? So and what do you like the most?
Okay, so in US, you have state of the art facilities, you have the state of the art knowledge, know-how, implants, and everything. It's very good, but again, it's very expensive over there. So if you don't have insurance to get operated over there, is going to, I don't know what will happen to you. What I have read also once is that even for taking out a tooth, if you don't have insurance, is something between $3,000 to $7,000, which is unheard of over here. Right?
Yes.
So if you don't have an insurance, there's a problem in the United States, but no doubt the facilities are very good. In UK, because of the NHS, which is government run, it is a very structured program, which is very good again. But again, it is a very slow process. So if you say you are a patient who requires a hip replacement and you go to that doctor, he would give you an appointment of the surgery after 5 months.
Oh.
And over here, I don't know if it can be done on the second day itself.
Right.
So the structure is good, but it takes a lot of time in
Yeah.
UK. So I think in India, if we compare, it is a combination of good practice, good structure also, and timely treatment.
Yeah.
So I think for people over in India, it's, I think, the best time to be in in terms of being, the doctors are very super specialized, very knowledgeable. We do all the surgeries which are at par with those countries also now, so we are not lagging behind. Even you'll be surprised to know ankle replacements are over here. The numbers are not that much because it's very expensive at present, but we are already doing ankle replacements. So there's nothing that like before 20 years we would say that US માં થાય છે, UK માં થાય છે, અહીંયા નથી થતો. We are at par. So whatever surgeries I am doing right now, saying ankle in sports injuries, are exactly what is happening, and the implants are the exact what they use.
Right. So in US and UK, they are taking a lot of time, right? So is it because of shortage of doctors, or is it something else?
I think it's a combination of everything. It's because this is my personal opinion. They want to be medico-legally very safe also. Doctors are less, but from what I know from our patients which come from London, say from Canada, they generally say that even if I have a foot pain, I have to show to a general practitioner first.
Right.
And he will give you medications, and unless and until he's sure that an X-ray has to be done, they will not go for it. They literally have to plead with them that get an X-ray done, I might have a fracture or I am having immense pain. And when that X-ray has been done or something comes up, and then giving an appointment for a orthopedic surgeon or a foot and ankle specialist, it would take you anywhere between 3 months to 4 months. So I think the procedure, as well as the lack of doctors, there are plenty of complexities.
Right. So mainly the procedure, the main procedure. Yes. What kind of shoes should we wearing for the sports like football, cricket, or tennis? And what should we wear in our day-to-day life as well? So what do you suggest?
So now it's very good actually. The pickleball, badminton, tennis, you have shoes different for all of them, right? If you're playing badminton, then you know what kind of shoes do you want. If you're playing table tennis, you know what kind of shoes. So that kind of takes away the basic problem that which shoes I want.
Right.
Now, second, what you need to do as a person who's playing is it should be comfortable. It should have good shock absorbing mechanism. cushioning should be good. There should be a little arch there, and it should be a proper size. That
Right.
is what you need to take care of. Otherwise, the marking, non-marking shoes, exactly you know which sport will give you what. In terms of office shoes, I would always not recommend shoes which are pointing, which have a high heel, which have a hard, leather formal shoes. It's not good for the feet. And if you're having flat foot, just make sure you are never wearing Crocs. Because Crocs is something that you shouldn't be wearing if you have flat foot.
And like what shoe brand do you actually trust as a surgeon, as an expert?
So generally, I do say that I don't believe in brands, but the fit should be perfect and your feet should be aligned properly. If you're having customized insoles like in flat foot, then the shoes actually don't matter, because that is going to do most of the work. But if you just press me and ask me, no, which brands do you actually would be happy with? I would be happy with an Under Armour, a Hoka, or say Asics. And these are the first three brands which will come to my mind.
Yes, nice. So what's the message you would like to give to young athletes who want to go with some long and injury free career?
So for athletes, first thing I should say is don't ignore the pain. The initial time that you have the pain, don't think is that it is my weakness, but take it seriously and a warning sign. So pain can be a good warning sign for something impending to happen. Secondly, please train yourself before the trainings also. That means warm-up exercises, taking care of your sleep, nutrition, stretching exercises, footwear. All these are very important, almost as much important as your game time. So taking overall care of your body for the longevity is required, not just the talent and just working out. So if you take everything into a proper barometer, I think you should be very good.
Okay, nice. Thank you very much.
Thank you,
sir.
Parth. Thank you so
very
much.
much.
Thank you.
Thanks for being here. Thank you for watching. Stay tuned for more powerful conversations.